Today we have with us Jordan, Jessica, Sarah, and myself discussing fetal alcohol syndrome.
Well, hi guys. We're going to talk about fetal alcohol syndrome in either all of the United States or all over the world. Kind of what is it? Who wants to give kind of like just a broad definition to start us off with the conversation?
Yeah, well, fetal alcohol syndrome is the result of alcohol consumption during pregnancy. And there are a variety of risks associated with fetal alcohol syndrome. You could have a stillbirth pregnancy, a spontaneous abortion, premature birth, and then you have risk of growth delays and low birth weight. Later in life, there's also secondary issues, including academic failure, substance abuse, mental health problems, contact with law enforcement, and inability to live independently. Now, this may vary dependent on certain cases, but these are things that we want to be mindful of when working with people with fetal alcohol syndrome.
Do we know how often this occurs?
Well, 12,000 children are born with fetal alcohol syndrome in the U.S.
About 119 children are born with fetal alcohol syndrome on a global scale, and 10% of women in the general population consume alcohol during pregnancy, and 1 in 67 women deliver a child with fetal alcohol syndrome.
Alcohol-exposed pregnancy is the leading cause of preventable birth defects in the U.S.
Yeah, that's a lot. That's kind of more than I would have expected. I know that it happens. It happens a lot more with 18 to 24-year-olds because of the kind of popularity or stigma even behind underage drinking and just the college environment in general.
For sure. And fetal alcohol syndrome varies depending on different demographics and culture and location, which are going to be important to be mindful of in the therapeutic relationship.
When thinking about what you said, Sarah, thinking about younger women ages 18 to 24, a lot of them are in school-based environments, so a lot of them actually don't become aware that they're pregnant, and oftentimes it's too late when they do become aware because they were in an environment where alcohol consumption was normalized.
Some people may wonder what the motivation would be behind continuing to drink while pregnant. This attributed to risky drinking. In one study, also 50% of women do not recognize their pregnancy until the 6th week of conception, while most women abstain from alcohol following pregnancy recognition. More than half of pregnant women recognitions come after fetal brain development has already begun.
Do you think if we had like more screening tools and like interventions earlier on in pregnancies that we could reduce the risk?
Actually, in 2002, the Congress and Control and Prevention Center met and led in creating shared criteria, screening tools and interventions for alcohol syndrome identification and detection of alcohol use in pregnant women.
That sounds super helpful.
I think there's also another intervention that was in place through kind of public intervention as well. In the United States, there's mandatory warning signs that requires any establishments that sell alcohol to be consumed either on or off premise to post signs about the dangers of drinking alcohol while pregnant. In the study, they talked about kind of psychoeducation for mothers, and if a mom was to drink within the first week, last few weeks, or any other time within the pregnancy, like would they still be at risk? Or if there was chances of miscarriage, cognitive delays, behavioral problems, or anything like that while drinking while pregnant. And kind of just regardless how many drinks were consumed, it could still lead to fetal alcohol syndrome in the fetus. And 52% of the participants understood and strongly agreed after the fact that drinking while pregnant will develop harm in a baby. So I think the education and the signs kind of gave more awareness to the issue.
Well, on the topic of awareness, are you guys interested in talking about stigmas associated with fetal alcohol syndrome, both on the child and the mother? I know it seems as though there's a lot of harsh judgment around, mothers of children with fetal alcohol syndrome, that they're deserving of that harsh judgment and are bad or neglectful and abusive parents. And there's a bunch of different stigmas that are associated with the specific disorder that I think is worth talking about.
I feel like a lot of the beliefs around mothers drinking during pregnancy are super simplified, especially because a lot of times it comes with substance use dependency, substance use disorders, and they're kind of put in a spot where they're personally responsible for their consequences instead of seeing it maybe like a different light, such as also having mental illnesses or substance use disorders that would come along with it.
Yeah, I feel like a lot of the stigma too is looking at like elements of even just down to the basic needs, because they could still be drinking alcohol regardless what environment they're in. Like, they could be a very wealthy family who just drinks wine every night, like as a cultural aspect. Or they could be down to the bottom where they're homeless and they're drinking because that's just what they have access to, and like they may not have the shelter or food that other people might have, or even kind of just right in the middle. They could be dealing with a substance issue, but I think with different types of families and support systems and the basic needs of shelter, food, and like if they're employed, unemployed, or if there's like mental or medical diagnosis at play, I think that can all contribute to how severe the fetal alcohol syndrome could be, or how severe the mother's addiction could be.
Yeah, I think that relates a lot to kind of protective factors as well. What you talked about, security and shelter and basic needs and food, employment, and the financial situation. So I think those are really good things that go in with stigma, because you already have the stigma of maybe being homeless or being unemployed, and then you have the pressure of being a young mom and being like, oh, how am I going to provide? And then you also don't have the coping skills or maybe the access to care, like you said. And so there's just a lot of added stress that are put on mothers who are dealing with substance abuse.
Mm-hmm.
Yeah, and on the topic of stress and, additional things that are going on in the lives of these individuals, there's also commonly seen comorbidity with other mental health diagnoses such as depression, anxiety, bipolar disorder, schizophrenia, post-traumatic stress. There's, a long list of things that are also associated or can be associated with substance use, and those are other factors that might be taking place with these individuals as well. In addition to mental health diagnoses, there's also, medical diagnoses. A few examples are cancer, HIV, heart damage, reproductive issues, so to be mindful of.
Yeah, I would agree. A lot of issues can be caused by substance abuse to the mother or the child. And I think with the child, it's both medical and mental, as they're born with it. Unforeseen consequence, because they don't really know what's going on or how to deal with these issues as they were just born into it. There's a lot that goes into the effects on the child.
A lot of attention has been brought to kind of the academic life that has been a little bit more difficult for children struggling with FASD, such as learning disabilities, attention deficit disorders, conduct disorders, risk of mood, anxiety, conduct and attachment disorders through alcoholic exposure that persist into their adulthood. And actually about 50 to 80% of children exposed to alcohol in the womb exhibit ADHD diagnostic criteria, according to one study that was done in 2013.
Also, the additional stresses on a child suffering from FAS. They have stresses on their social life. They often display difficulty with emotional regulation. They're deficient in recognizing facial emotions in their peers, which play a crucial role in their ability to be effectively socially functioning. It's associated with less accurate interpretation of negative and neutral mental state. However, at the age of 17, some children no longer perform poorly, and there's hope that they can developmentally catch up instead of a lifelong deficiency, but that also has a lot to do with early intervention, and that also is a lot related to ADHD. We know that children who suffer with ADHD also have a hard time connecting with peers. And so those are two very conflicting things that can make it difficult for them in their social life growing up.
Well, on the topic of areas that are impacted, I'd love to look at, physical areas as well. And these physical areas can include growth abnormalities, some impairments in the neuroendocrine system, including increased risk of cell abnormalities in the heart, various tissues, bones, kidneys, as well as visual and auditory systems. So these can cause some genetic abnormalities, and in general, these individuals are more likely to experience impaired immunity and increased susceptibility to infection.
And I worry that for a child in today's society, bullying could be a very big topic. And I think that could do a lot of psychological damage in addition to their psychological problems that they may already be facing. And that could look like acute psychiatric and developmental disorders, and even complications within the central nervous system. And adults who have experienced fetal alcohol syndrome will probably have high rates of brain abnormalities throughout development. and regulatory management problems. This could lead to comorbidities of like schizophrenia, psychotic disorder, bipolar disorder 1 or 2, anxiety disorders, or like different phobias, panic attacks, and like PTSD, eating disorders, and depressive disorders. Many individuals with this disorder have IQs below 70.
So who wants to get us started talking about what counselors in a therapeutic role can do to help people who are suffering from these illnesses?
Yeah, well, this is incredibly important for us to be mindful of, especially as our board of counselors that we have here discussing today. You know, Sarah mentioned earlier, recognition and interventions or treatment for children who suffer from fetal alcohol syndrome has been shown to be, incredibly effective in enhancing long-term outcomes. So we can take a look at some theories, some types of therapy, as well as some coping mechanisms that are going to be potentially helpful that we can utilize in our relationship with these clients.
Yeah, so a huge one is psychoeducation. This increases education, conception, awareness in relation to alcohol consumption and can help in preventing fetal alcohol syndrome in mothers, as well as medication therapy. This could be something like replacement therapy, replacing original substance with something less harmful. There's also screening tools used for pregnant women and identifying FAS in individuals as well, including the TAC and the TWEAK assessment or questionnaire. Typically, women who drink about 3 to 7 drinks per week should be assessed for developing FAS. There's also brief therapy, acceptance and commitment therapy, dialectical behavior therapy, parent-child psychotherapy, and family therapy. And there has also been several research projects, such as Project Choices, which is an evidence-based intervention project for women who are at high risk of alcohol exposure during pregnancy.
I think psychopharmacology would also be a great asset to the mothers and maybe the child who have been undergoing this process.
Yeah, for sure. Let's talk about that. So, according to studies, stimulants were the most commonly prescribed medication. I think this is definitely interesting because, as we've talked about, there's many different, side effects and impacts of stimulants. So, looking at how medications and the comorbidity between different disorders are going to impact the client that we're working at would be, definitely crucial in this process. There's also a really interesting study done on the impact of psychopharmacology and how insurance coverage may impact fees, diagnoses, and accessibility. In addition to looking at medications, it also would be pretty important to look at coping skills and creating a detailed action plan and reduce their drinking and move forward in, the preparation stage and action stage.
Yeah, I think in the aspect of the preparation stage and action stage, we could make a lot of referrals depending on how severe the addiction may be. They put them in like a rehabilitation center or like wean them off of the amount they're consuming, put a plan in place to support the child, as we don't want to put their safety at risk.
So in therapy and treatment, therapists should work collaboratively with these individuals to foster a safe and overall supportive environment.
Yeah, and speaking too, it's important to note that withdrawals from alcohol can be fatal, so making sure that our patients are going to detox programs as necessary so that you can ensure the safety of your patient and also the baby and fetus. Also, methadone programs. Thankfully, in Rochester, we do have a methadone program that we can make referrals to. Pregnant women go to the top of priority in methadone programs. They have to leave the window open for dosing until the pregnant women are reached. It's just really important to be making those referrals and be connecting them with those resources.
Yeah, in terms of how we look at treatment with children as well as, parental treatment, incorporating strengths into daily activities showed a reduction in anxiety and improved participation. Providers should consider incorporating strength-based approaches and an explicit focus on facilitating the development of positive self-identities. Mental health counselor can even utilize finding the individual's unique features and using this as kind of a protective factor. There's also improving the communication skills of youth with FASD, which could translate to a better overall functioning. And lastly, early interventions targeting core neurocognitive deficits have the potential to make more positive effects for development later on in life.
And I think it's just important that we keep like the ACA code of ethics in mind as well, as we just want to provide an overall benefit for the child's well-being and the individual. With the alcoholic addiction, we want to create an autonomy of letting them have the right to make their own decisions, but also kind of bringing them to a place where they feel they might be making the better decision. We also want to incorporate non-maleficence, as we don't want to harm them and we don't want them to harm themselves or the child. And we also want to seek justice by providing them access to all the resources in our communities for the child and mother's benefit.
Yeah, let's talk more about some of the resources that are available.
Well, I know, Katarina, you talked about the methadone program, and I think that's a great option for the mothers who have such severe alcoholic addictions where they need to be weaned off in the hands of medical professionals so that they're not in harm's way and the child's not at any risks.
Yeah, Strong Recovery has a great methadone program. Normally do breathalyzers for the first 60 days that you're on the program. They will have access to other healthcare professionals, nurse practitioners.
Yeah, and something that's actually really unique to Rochester is Mount Hope Family Center, which has its own clinic for FASD diagnostic and evaluation. It partners with Golisano Children's Hospital that is also kind of related to Strong Hospital within the University of Rochester Medical Center. It serves children and adolescents from infancy to 16 years old with evaluations and neuropsychological assessments, as well as aiding in their treatment plan. They have a family night program, which is a monthly program provided at no cost. They provide presentations. This is a really good resource for with psychoeducation and facilitating social support, socialization, provide a dinner, as well as developmentally appropriate activities for children and teens.
Speaking of support, more support options for people in the community are Alcoholics Anonymous. People can find sponsors, can help kind of be a guide. Also Children of Alcoholics, which is another support group, and a variety of rehabilitation settings such as Rochester Rehabilitation, Freedom House, and East House, and there are a variety of corporations.
Those are definitely a lot of great support and outreach things that we can refer patients to who are struggling with this.
Yeah, I think overall our society has a lot of preconceived notions, a lot of simplified beliefs instead of, looking at each and every case as its own, things going on, comorbidities. Everybody's coming from different backgrounds.
And the fact that we're all human. I mean, I feel like that often gets taken away by those stigmas.
And it's just important to remember all those distinct things in the complexity, like Jess and Jordan and Sarah were saying, of people who are suffering from alcohol use disorder. And there's just so many things and pressures that are pressing on them. And being aware of that as clinicians and looking at a person holistically is really important for these people.
Great point.
Yeah, I think this was a great discussion, guys.
Woo-hoo.